Disease expert, senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja. Hey, doctor, haven't seen you in a while. It's good to see you. Good to see you.
Good to see you as well. Thanks for having me.
Court of course. And Gay spent 14 days quarantined on the Diamond Princess cruise ship in 2020 due to a COVID outbreak. So she knows the pain, and we'll get that perspective. Doc, hantavirus, human to human? If that's true, what does that mean?
Well, we've always known that certain strains of hantavirus can spread person to person, particularly the strain that's dominant in Argentina, where this whole trip originated. So that, even though that strain is transmissible person to person, it's not like COVID. It's not like measles. It's not a very efficient transmission. It's something that requires close and prolonged contact. So even if that's occurring, and it seems that that's the case on the ship, it's something that can be stopped. It's something that's going to be delimited versus a respiratory virus, for example.
So do they need to do what they're doing to these people?
Not all of it. They definitely need to make sure they understand who's infected. They need to connect those individuals to care. They need to figure out who is exposed and watch those individuals to see if they develop symptoms. They need to be able to disembark, though. And the Cape Verde Islands aren't letting them disembark. The Canary Islands are going to let them disembark. Because I think when you concentrate these people on a ship, it increases the dread factor. If there is transmission going on, it intensifies it. And it makes it a big spectacle when there are tried and true public health principles that can apply to end this as quickly as possible.
Right. Amesh is talking and Gay is like, man, is he right? Because I lived it. What is the hardest part of being on a ship like that with people who are sick and it's spreading?
That feeling of panic and not knowing if it's coming for you next. We were immediately quarantined in our cabins and given a lot of protocols about what to do, but still, people kept getting sick every day.
How long do you think it takes, Doc, for them to get off, and how long until we know who has it and who doesn't?
Well, right now, we know that there are teams of doctors that have boarded from the Cape Verde Islands, but it's going to take a couple of days before they get to the Canary Islands, which are controlled by Spain, and they're able to disembark. So it's going to still be several more days before we get full situational awareness of what's going on. I think the priority right now has to be to get the sick people off now and get them linked to care, because this is a disease where they need supportive care. They may need oxygen. They may need to be in an intensive care unit. All of that needs to happen now, but it's going to be a couple of days before we understand exactly what's going on.
Amesh, it's good to see you again. Thank you very much, Dr. Adalja. It's very nice to meet you. I'm glad this is in your rearview mirror, and I hope it is for these people soon as well. Thank you for giving us your perspective. 4 minutes and 15